Hi, I'm Helen Woodrow.
And I'm Amy Rush.
And we're both highly specialist speech and language therapists working at EG Training and Speech and Language Therapy.
This vlog is part of a series of vlogs that we've created to tell you more about the specialist speech and language therapy services that we provide. This vlog is all about the jaw and is number 1 in our series of vlogs. Our jaw is the foundation at the oral level for eating, drinking and speech. The jaw provides the stability and the base for our lips and tongue to move with confidence within articulation and when chewing and feeding. Within normal development, we have to develop jaw stability. This is the ability to hold our jaw in a position with symmetry and alignment. Jaw grading would come next, which is the ability to move the jaw at different heights for different tasks, i.e. for spoon feeding you might want to have a high jaw position to take the food. Jaw dissociation is the ability to move the jaw in isolation of the head and the rest of the body. Quite commonly with people we work with, we'll see them using their whole head in order to move the jaw. Other skills that we need in the jaw are control, which is whereby we have a smooth movement when completing activities. Symmetry, which is where both sides of the jaw are even when active. Alignment, which is exactly what it says, that things stay in alignment when moving and there's no sliding or jutting. And then a final side of the jaw is stimulation. So a lot of people we work with are looking for stimulation at the TMJ, which is this joint here. Often we find that children with Down syndrome can be seen to be teeth grinding, which is their way of getting stimulation into this joint, which is quite soothing. So thinking about when problems can occur with the jaw, in our population of people with Down syndrome, we tend to see that they have an open jaw position due to low muscle tone. They often need support to develop their ability to access different heights in the jaw and to be able to grade the movements when completing tasks. In people with cerebral palsy, we may also see needs relating to the tone, but these are often different. This can either be a high jaw position, which is fixed, or a low fixed jaw position, and they find it hard to access the heights in between. They then need the same sort of support as children with Down syndromes in order to get between the different heights. We can see in individuals when their dissociation has not developed that they may use their whole body or head movement to be able to activate the jaw. This is very common in children with cerebral palsy, as they have very limited control over their tone in their whole body. Problems with symmetry may result in a slide or jut when the individual puts demand on the jaw in function. This can often make eating and drinking very challenging. So some ideas for helping with the jaw: we might use chewy tubes or arc grabbers in order to work on a symmetrical and controlled munch chew movement. Or we might use jaw grading bite blocks to work on the different heights that I've discussed. So for spoon feeding you might use a smaller one, and for a long R sound you might use a bigger one. There are also quite a lot of eating and drinking tasks that you can complete, such as gum chewing and repetitive chews on a crunchy food. There are many fun and functional tasks for the jaw, and these can be extremely motivating in a programme when they include food. Using food can be a way in with a client in order to help them to accept the use of a tool. Thank you for watching. We hope you enjoyed that and found it really useful.
Don't forget, this is just one of a series of vlogs, so please do check out all the others as well.
And to get a lot more information, please visit our website at www.eg-training.co.uk.